Welcome to this webinar, everyone. We're going to make a start now. Hopefully everyone can hear me clearly and can see the slideshow in front of them. My name is Trina Revelt and I'm with my colleague Nick Axford today. We're both from the Social Research Unit and we will be delivering the second webinar of the Youth Justice Board's Effective Practice series. We are a charity located in Dartington dedicated to improving outcomes for children, and we've been commissioned by the Youth Justice Board as independent experts to deliver this series of webinars. And you can find out more about us when you visit our website at www.dartington.org.uk. First, I'd like to cover a few housekeeping items for those whom it's the first time to join us. Similarly to our last webinar, you are all on listen-only mode and we cannot hear you. The reason why we have removed any sound coming from the participants is to ensure a smooth audio delivery of the presentation. For the same reason, we do not provide a video broadcast. All this helps us to accommodate your broadband speed, since providing both audio and video would slow it down and your webinar experience may be interrupted. You all should have a question and answer box in the control panel on the right-hand side of your screen, where you can type in your questions or comments as we are going through the webinar. If you run into any technical problems during the webinar, you can try getting our attention by clicking on the hands up button, which you can find on the left-hand side of the tab, on the tab of your control panel. Or you can also email to my email address, which you all should have, and we'll respond to you as soon as we can. Again, similarly to the last webinar, to make sure that you can all hear us and have found the hands up button on your control panel, I'd like you to press that button now. Okay, we can see the hands coming up. Excellent. You can press the button again to put your hands down now. Great. This webinar will be recorded and will be available for you to download in the next few weeks, and we will send those details through to you. So if you have any technical problems today, you will be able to access this webinar later. Now, this webinar is the second of the series of 5 webinars. Many of you joined us at our first webinar on what is evidence-based practice, a recording of which is available on our website. Today's webinar is on what's our evidence-based programs, and the topics of the upcoming webinars are shown on the slide in front of you. All webinars support the launch of the forthcoming Innovation and Evaluation in Youth Justice materials that are designed to provide youth justice practitioners with advice and information about program developments and evaluation. We are very excited to see a number of people from various organizations being interested in these topics. For example, today's webinar has been joined by the representatives of youth offending teams, members of the Youth Justice Board, NHS, researchers and representatives of non-profit organizations that are providing services to young people and their families. We're very grateful for everyone's feedback to our first webinar. We will be sending you a link to an online feedback form after today's webinar as well, and we would really appreciate it if you could spare a few minutes to complete the feedback form. The webinar itself should last about an hour, and it's divided into 2 parts. We start off by giving you a presentation that will be followed by a discussion where we can take questions that you're sending through to us, and Nick and I will try to answer those questions. In case we don't get through all of your questions today in the discussion session, we will collate the frequently asked questions at the end of the webinar and share these later on. Again, we will send those details through to you. So I'm going to take the first half of the presentation and Nick will take the second half, and both of us will be involved in the discussion along with you. So the focus of today's webinar is on evidence-based programs, what they are, and their strengths and their limitations. As discussed in the first webinar of this series, Evidence-based programs and the usefulness of evidence more broadly have been promoted by some influential opinion formers, such as Cabinet Secretary Sir Jeremy Haywood. This is also clearly a priority for the Youth Justice Board. Take their program development toolkit and the forthcoming innovation and evaluation in youth justice materials. These show commitment to improve the quality of crime prevention initiatives in this country by promoting the use of evaluation and building the evidence base from the bottom up. And this is just one of several national initiatives. Running through all of them is an emphasis on evidence-based programs. So what is an evidence-based program? In the first webinar, we defined a program as a discrete, organized package of practices spelled out in a guidance, sometimes called a manual, that explains what should be delivered to whom, when, where, and how. By evidence-based, we mean tested and effective. Tested means that the program has been put through its paces by a high-quality impact evaluation, and effective means that there is strong evidence from the evaluations that the program makes life better for children or families. In other words, a program is evidence-based when it's been evaluated robustly and found to have a clear positive effect on a relevant outcome for children or families. The YJB uses the term research proven in its practice classification framework to capture the same thing. Obviously, not every program that claims to improve children's lives can be called evidence-based. As you will know, there are hundreds of programs that say they benefit children. Unfortunately, only a fraction can demonstrate high-quality evidence of impact. And this is where the standards of evidence come in. In the first webinar, we summarized our what works standards of evidence. We said that you can use them to help assess whether an established program is worth implementing or to guide the development of a new program. They have 4 key dimensions, and we're going to go through them here. The first dimension relates to the design of the program. It looks at whether the program is focused, practical, and logical in improving outcomes. And we call this intervention specificity. So, what are the main features of a well-designed program? The first crucial feature of a well-designed program is a focus on the specific outcomes that it tries to influence. For example, the outcome could be less reoffending or better mental health or improved literacy. Simply put, you know what it is expected to achieve for young people and families using it. Second, a well-designed program is clear about its target group. Some programs are designed to reach an entire population regardless of need or risk. They try to stop the problem happening in the first place. Others intervene at the first signs of trouble to stop things getting worse. Still, other programs try to reduce the negative impact of existing problems. The programs that prevent problems from occurring are called prevention programs. A good example is Good Behavior Game. It's a classroom management program where the teacher divides a class into teams, mixing children with different learning abilities and behavior patterns. She then explains good behavior, for example, working quietly on assigned tasks, and bad behavior, such as talking out of turn or fighting. And then teams are rewarded for good behavior and penalized for bad. And gradually, the game and the good behavior with it becomes a normal part of classroom life and eventually of life beyond the classroom. Now, Good Behavior Game has many positive outcomes, including reduced future offending, alcohol and drug abuse, and antisocial personality disorder. Programs that prevent things from getting worse are early intervention programs. Now, these are implemented in the early stages of a problem to prevent it from developing further. And a great example is the Incredible Years Parenting Program. It is aimed at parents whose children have conduct problems. Without early intervention, a future conduct disorder is more or less inevitable, and we all know that this is likely to lead to offending. So Incredible Years intervenes before a conduct disorder occurs. The programs that are implemented once what could go wrong has gone wrong are treatment programs. And functional family therapy, or FFT, is a good example of that. It is for young people with high levels of antisocial and offending behavior, the kind who are in frequent contact with social work, youth justice, and mental health agencies. It provides concrete behavioral intervention to guide and model specific behavior changes in terms of parenting, communication, and conflict management. And these behavioral changes help to reduce offending behavior. A third feature of a well designed program is clarity about their components. In the design phase, a program is often delivered by its creators. They know it inside out. But if the aim is to improve children's well being further afield, future providers and practitioners need to know what the program comprises. And this requires clarity about what is provided, by whom, over what period, for how long, with what frequency, where, and how. Put another way, you need to spell out, for example, the content of an intervention. Are you providing information? Is it about advice? Is it about training? Is it about money? Or what is the length of your sessions? Is it 2 hours? Is it 1 hour? And so on. It is also vital to communicate what is core and therefore can't be changed, and what is peripheral and therefore adaptable. This is because the success of a program rests on both fidelity and versatility. It must be possible to repeat the key ingredients that make the program work while molding it to fit the local context. The smartphone offers a good metaphor. The electronics are essential and practically impossible to change, whereas the screen and applications or apps can be changed to meet the user's preferences. So what you see on the screen right now are shots of two iPhone screens. The one on the left is mine, and the one on the right belongs to Nick. And even though the inner workings of our iPhones are similar, we have different service providers. The apps that we use and the order and the layout of our apps are different, and we know instantly which phone belongs to each of us. And we love this flexibility. So when it comes to programs, this information on what can and cannot be changed and why needs to be captured in written documents, typically manuals, that are accessible and meaningful to people working in contexts quite different from the one in which the program was developed. We will cover manuals more in the fifth webinar in this series. A fourth characteristic of a well-designed program is clarity about how it is supposed to work. We call this a logic model. It explains why doing certain things with selected young people will achieve specified outcomes. Put another way, it spells out the mechanisms by which the program is hypothesized to prevent or resolve a problem. It also states the assumptions under which these mechanisms should operate. We could construct logic models for things we do in our everyday lives. For example, we could create a logic model for turning a light on. It would outline the sequence of events between pressing a switch and the bulb lighting up. When we develop a program, you start with a question, what do I want to achieve? Put differently, what outcomes are you looking for? Programs in youth justice aim to change offending behavior. In a logic model, you then work backwards, putting the required things in place to achieve this goal. It helps to ensure that the outcomes you want the program to achieve can be achieved. This is illustrated in this slide. Inputs are the resources you put into program or actions you will take in preparing to deliver it. Activities are the things you will deliver. This is what you expect to create the program's effect. Now, outputs are the short-term effects of or changes you expect as a direct result of your activities, and outcomes are the longer-term effects you expect to see as a result of the inputs. On the slide, you can see a simple example of what this means in youth justice. Another way to develop a logic model is to sketch out a path leading to the poor outcome the program is trying to prevent or reduce. This shows what risk factors need to be addressed, Next, it notes what is known to make the poor outcomes less likely given those risks. This shows what protective factors need to be enhanced. And lastly, it maps onto the program components that address the risk factors and enhance the protective factors. Logic models are a useful device for communicating the rationale of the program to a wider audience, including the project workers who deliver the intervention and their trainers, the children and the families who receive the program, and even commissioners and potential funders. To find out more, there is a webinar on our website on how to develop a logic model or theory of change. The forthcoming innovation and evaluation materials from the YJB also feature practical tools for developing your own logic models. So we have looked at what is an evidence-based program and what are the main characteristics of a well-designed program, but what makes a program evidence-based? On that note, I'm handing over to my colleague Nick for the second half of our presentation.
Okay, so far we've focused on what a well-designed program is. We've used the first dimension of our What Works standards of evidence to elaborate this. But what makes a well-designed program evidence-based? And to answer that question, the second and third dimensions of the standards of evidence are relevant. The second dimension relates to whether program evaluations give us enough confidence in the claims about the program's impact, and we call this evaluation quality. The third dimension is called impact and refers to what robust comparison group evaluations tell us about how much impact the program has on child outcomes that really matter. When you ask, does our program work? You want to know if the young people or families who get it are better off as a result of your involvement. You might also be interested in other things. For example, do families like the program? Does it reach the right young people? How does it work? And these are all good questions, but none are about impact. 3 evaluation methods are widely used to assess impact. The first involves measuring outcomes at the start, in other words, before the young person or family has received the program, and then after the program. This is called a pre- and post-test evaluation. It allows you to estimate the distance travelled, and it's common in the early stages of program development and is a really useful first step in evaluating the impact of a program. However, it can't tell us that it was the program that led to any improvements. This is because we don't know what might have happened to participants if we'd done nothing. A second method tries to address this problem. It also uses a pre- and post-test approach, but this time it adds a group of similar young people or families who don't participate in the program, and they form what we call a comparison or control group. Their outcomes are measured in the same way as for participants on the program, and we call this a quasi-experimental design. The comparison group could be similar young people in a neighbouring area, but the use of average outcome data such as reoffending rates also offers a comparison of sorts. The strength of QEDs, as they're known, is that they can give us more confidence in our results. However, there's also a danger that the program and control groups differ at the outset on important factors, and that these differences might explain differences in outcomes. The third approach to impact evaluation addresses this problem by creating the control group in a different way. So you can see here, eligible young people or families are identified, and then they're randomly assigned either to get the program or to be in the control group. It's like tossing a coin. This is called a randomized control trial, or RCT. When done well, it can keep the two groups as similar as possible at the outset. The only differences between the groups is that one gets the program and the other one doesn't. Outcomes of both groups are then monitored. If the program group does better than the control group, we can confidently say that it's as a result of the program. Our What Works standards place the greatest weight on RCTs for this reason, followed by QEDs. We say a program is evidence-based when it has at least one good RCT or 2 good QED studies with clear evidence of a positive effect and no evidence of a harmful effect. course, some people might say that this is a high threshold, even too high. We would say it's true that such evaluations are not always easy to do, but surely if we're committed to improving young people's lives, reducing offending and so on, and using scarce resources wisely, we should set our standards high. It's also worth remembering why control or comparison groups are important. The graph you can see in front of you now shows what happens when a parenting programme was evaluated. Children's antisocial behaviour went down. On face value, we would say that the programme worked. But now look at what happened to the control group. Their antisocial behaviour also went down. In other words, getting the programme made no difference, and so we would have to conclude that in this case it had no impact. I just want to mention two important caveats here. The first thing is that a good evaluation is more than the design. In other words, the design needs to be well executed. For example, there are good RCTs and bad RCTs. So attention needs to be paid to things like sample size, how many people drop out of the programme or evaluation, how outcomes are measured, and how data are analysed. These all affect the quality of the evaluation. The better the quality, the more confidence we can have in the results. So our standards cover these things. A second caveat is that not every programme should be evaluated by RCT or QED. For example, some programmes are simply too early in their development to withstand such a demanding test. Pre-post evaluations are useful in these circumstances, as long as they're not used to make exaggerated claims about impact. So you've got a well-designed programme and it's evidence-based. It's been tested and found to be effective. The next question is, can it be implemented? And this is where the fourth dimension of our What Works standards come in. It relates to how easy it will be to implement the programme in the real world. For example, do enough information and resources come with the programme, like manuals, training materials, implementation procedures, and so on, for it to be rolled out in public service systems like education, health, youth justice, and social care? Is there information about what financial and human resources are needed to deliver the programme? And we call all of these things system readiness. This is important because otherwise programmes won't reach their full potential. Many children who would benefit from these programmes will simply miss out. In order for programmes to be delivered at scale, public service systems such as youth justice system have to be ready for evidence-based programmes, and programmes have to be ready for systems. Our standards are designed to help work out whether a programme is system ready, and we'll say more about this in the fourth webinar of this series. You might find yourself asking, where can I find out more about existing evidence-based programmes? And fortunately, there are now over 30 online databases or clearinghouses of evidence-based programmes. Most of these are published in English and based in the US, but there are also some in Europe, including here in the UK. These clearinghouses typically list programmes and provide information about each one, covering things like its components, how it works, what outcomes it tries to improve, who it's for, what training, materials and staff it requires, how much it costs, how it's been evaluated, and what effects it has. It's important to be aware that clearinghouses have different standards of evidence. Our standards align with those of Blueprints for Healthy Youth Development. The YJB standards of evidence are laid out in its practice classification framework and apply to all examples of practice in the YJB's effective practice library. We should say as well that the YJB's top category, or research proven as it's called, fits the social research unit standards that we've just outlined. Clearinghouses also vary in terms of their focus, for example, education or youth justice, and their function. Some exist to promote the greater use of programmes that meet high standards of evaluation, quality and impact. Others are much more about tracking new innovations that sound promising but require further testing. This slide shows some clearinghouses that are particularly relevant to youth justice. In the final section of this webinar, we want to turn to concerns and challenges relating to the use of evidence-based programmes in a youth justice setting in England and Wales. As you will know, evidence-based programmes can provoke strong reactions, both for and against. We think that some of the critiques are myths, but that others represent genuine challenges. We discussed some of the myths in the first webinar, for example, the claims that evidence-based programmes stifle innovation and turn practitioners into robots. We simply don't think these things are true. But there are at least 3 other myths that we want to address. The first is that some people fear that evidence-based programmes are taking over. The truth is that although evidence-based programmes are more widely known than even a few years ago, they still consume a very small proportion of the estimated £60 billion of public money spent on children in the UK each year. We think probably less than 1%. The second critique of evidence-based programmes is that the people who run them just want to make money out of children. It's certainly true that some of the organisations that sell materials, training and other services to help implement evidence-based programmes are for-profit organisations. But we would argue that across the public sector, commercial providers, for example textbook publishers, can be helpful partners. The key is making appropriate purchases. Moreover, unit costs for evidence-based programmes are often modest, and many programmes offer good value when the financial benefits they produce for individuals and taxpayers are taken into account. A third criticism of evidence-based programmes is that they're all from the US, and that what works there won't work here. Put another way, something developed in Seattle won't work in Stoke-on-Trent, and it certainly won't work in Sao Paulo. It won't fit culturally, and it won't produce the same effects. Many programmes with the best evidence, like Good Behaviour Game, Incredible Years, and FFT, do come from the US, but they're now being tested in Europe and several low-income countries. Some show positive results, others less so, but there's a lot of research going on at the moment to find out. We should say as well that great programmes are also being developed this side of the Atlantic. A good example would be the Kiva bullying prevention programme, which was developed in Finland. Moreover, there's lots of new investment in the UK to try and create homegrown programmes that meet the same high standards I referred to earlier. One example is the Big Lotteries Realising Ambition project, which is investing £25 million over 5 years in 25 crime prevention projects. And of course, this webinar series shows that the Youth Justice Board is keen to expand the use of evidence and evaluation in the youth justice system in England and Wales. So there are lots of myths, but there are also some genuine challenges when it comes to implementing evidence-based programmes, and here we're going to mention just 3. First, we need to figure out how to fund evidence-based programmes, particularly in an age of austerity and particularly in the long term. As you will know, different solutions have been proposed, such as reinvesting public resources, payment by results contracts, and social impact bonds. We'll cover all of these in the next webinar, the 3rd in the series. Secondly, we need to ensure that the right people receive the right programme. This involves correctly identifying the needs of children and families that we work with. No one claims that evidence-based programmes are a silver bullet. They increase the chance of a better outcome, but they don't work for everyone, and no programme meets a child or family's every need. By fitting the right programme to the right young people, we will maximise the chances that our programme will be effective. And again, we'll discuss this more in the 3rd webinar. Third, to be delivered well, an evidence-based programme needs a good practitioner. For example, a skilled practitioner with the ability to form relationships and to be warm, sensitive, interested and empathetic is particularly important when working with a hard-to-engage target group such as young offenders. It's the combination of practitioner ability and program structure and content that yields the better outcomes. And the fourth webinar in this series will cover practitioner skills in more detail. So these are just a few of the challenges to successful implementation of evidence-based programs. And of course, we're interested to hear of more from you in the discussion, which we'll now move into. I know Trin's been collating some questions for us to answer. So we'll take one of the first few questions, and by all means, if you have any others, do please keep sending them through.
Thanks, Nick. We have quite a few interesting questions that have come in, and the first one is, you mentioned clearinghouses and databases for evidence-based programs. What databases should we prefer?
Okay, that's a good question. As I said, there are, by our estimation, over 30 such databases. And as I said, they vary enormously in terms of their focus and their function. One that we always point people towards is the Blueprints for Healthy Youth Development database, which is www.blueprintsprograms.com. I should say we're somewhat involved in that, so I guess we have a vested interest. I think there are lots of others as well, though. For example, if you look in the other side of the Atlantic, there are things like promisingpractices.net, which is worth looking at. The ones that we put on the slide earlier are good to look at. Here in the UK, there are several. So a good example, of course, would be the Youth Justice Board's own website, where various programs are classified. There is one by the Centre for the Analysis of Youth Transitions, or CAYT, which is housed in the Institute for Fiscal Studies. And if you look there, there are various programs worth looking at. The Centre for Excellence and Outcomes here in the UK has lists various programs as well, but probably is more about tracking innovations rather than programs that meet very high standards. So I think there are lots of places to look. If you go to Blueprints, you'll certainly find a lot that are very relevant to youth justice. But as I say, just be very careful when you look on these databases to check what the standards are, particularly because some list all programs, not just those that are effective. They may list programs that have no effect. Sometimes they even list programs that have a harmful effect. So you just need to be really careful about that. Okay, let's see, we've got some other questions here. So this is a question which I'll give to Trin. What are your thoughts on tailoring evidence-based programs for specific ethnic groups? Do these programs need to be tailored for them or not?
That's a really good question. In all honesty, evidence-based programs tend to show similar benefits for all ethnic groups. And most of the principles on which they're based, such as wanting to help children to grow up happy and healthy, these are valued by all ethnic groups. But as we discussed in our first webinar on evidence-based practice and the importance of client circumstances and client preferences and client's cultural background, it is essential to take all this into account and to make sure that programs are implemented in a way that it doesn't alienate participants and they get engaged in programs. So, for example, if a meal is served, facilitators can choose foods that are acceptable to everyone attending. And this is just one simple example, but there are multiple things that could be considered when working with different ethnic groups. And in terms of tailoring programs, recently a very interesting systematic review by a group of researchers from Oxford University came out that looked at implementation of parenting programs that improve positive parenting skills and reduce harsh and abusive parenting. And they examined studies that took place in middle and low income countries, because we're very much used to the fact that all these programs tend to be developed in high income Western countries. So there were multiple studies, and they took place in countries such as Brazil, Chile, China, Iran, Jamaica, Pakistan, Turkey. There are some in South Africa, some in Ethiopia, and they very much tested those programs that were developed in those high-income countries. And all these studies showed that we have a reason to believe that these sort of interventions have the capacity to improve outcomes for children in very different contexts. So adaptations are needed, but not to the large extent.
Okay, thanks, Trin. There's another question which has come in, which I think is related, and it's what are your thoughts on the importance of having regional or local programs which are unique and evidence based? I'll answer that, and then Trin can add. I think my sense on that is that um, it depends on why you think it's necessary to develop something unique. In other words, what do you think is unique about the particular situation that you're working in, or the particular young people you're working in? There's lots of evidence, as Trin has touched on, that patterns of risk and protective factors and their relationship to outcomes are consistent in different contexts. So I would probably advise looking initially at what evidence-based programs exist for the outcomes or risk and protective factors you're concerned about, and if necessary, you might want to adapt. And we can talk a bit more about that later. I think if there's something particularly unique that you think needs to be addressed, and that no other program does currently, then of course you should look at developing a new program. But obviously, there almost certainly there would have been other research conducted around the problem you're trying to address, and you'd want to take account of that. So thanks for that question.
Relating to the local and regional programs in the UK, Nick, can you say more about programs being developed in the UK? Perhaps you could say something about the Realising Ambition project.
Yeah, sure. So we're aware that there are lots of programs that have already been developed here in the UK, particularly by voluntary and community agencies, but not exclusively so. But the Realising Ambition project is funded by Big Lottery. Again, it's something we're involved in at the Social Research Unit. Big Lottery is funding 25 projects across the country. 15 of those are new programs, and Big Lottery is funding them to go through a process of trying to improve their programs against the standards of evidence I outlined, or Trin and I outlined earlier. So, for example, all of them are having to develop logic models if they haven't already developed them. They're having to tighten up aspects of their intervention, like their target group, the outcomes they're focused on, their intervention components. They're developing manuals and training materials and so on. So it's it's quite a systematic approach to trying to grow evidence-based programs. And as I say, in most cases, these programs exist already, but we're going through a process of tightening them up, and trying to improve them against the standards of evidence. Okay, so a question for Trin. How do you know in a program what is core and what is adaptable?
That is almost a tricky question because we quite often do not know, and this is one of the areas of research that researchers are very much interested in these days. So it's almost less about developing new programs because there are quite many out there, particularly the ones that haven't been tested yet. But it's really more about identifying what are the essential core components that make these programs work, what is essential to keep in, and so on. And it's not only about specific activities, but also different principles and theoretical perspectives that may make a program work. So, for example, when you look at the parenting programs, what we know by now is that there are certain things that make those programs effective. For example, basing the intervention on social learning theory principles, or working on attachment, trying to improve a parent-child relationship, or for example, using principles of cognitive behavioral therapy in parenting programs to deal with parent stress and anger, or working with teaching parents things like nonviolent sanctions for problem behavior and little things like that. And also the way parents learn, for example, doing role plays, doing modeling, giving them practice sessions and giving them homework. These are all different components and bits and pieces that we know now make the interventions effective and improve outcomes and produce the results that the programs are set out to produce. So a lot is still unknown, and it's a big field for researchers to cover. But every day we learn more and more about specific components that are relevant for various types of interventions.
Okay. Okay, so another question that's just come in. Can you say something about gender mix in programs? Is there evidence that programs need to be gender specific or not? I'll just give a quick answer to that. I think first, often programs, in most cases, programs are developed with both genders in mind. When evaluations are done, in the very high quality evaluations, often they don't tease out the difference in effect between gender groups. When they do, there is some evidence in some cases that programs work for boys but not for girls, or vice versa, and clearly that should be taken into account. If you look at, for example, the Blueprints database or some of these other databases, you might find there that they do say this is a program that's been approved for use with boys rather than girls. So that's just a quick answer on that one.
We have a question that has come in on effective practitioner, namely, what are the challenges in terms of scaling up an effective practitioner to deliver evidence-based programs? And what we've learned from the literature and research is that one of the things that helps to become a very effective practitioner and support the scale up of these various interventions is a practitioner being able to critically review research evidence, have some knowledge of research methods, and be able to identify what is bad evidence, what is good evidence in terms of effectiveness. But just because we have a practitioner who might have those skills, that on its own is not necessarily sufficient to support a scale up. We also need organizational support. For example, just because a practitioner knows what good evidence looks like and how to potentially use it in everyday practice, the management may not be supportive of implementation of evidence-based programs. And even if they are supportive, they may lack authority to change daily practice. And often there just isn't enough time to address all this, to familiarize yourself with new research, to implement new ideas, and so on. So there definitely has to be organizational support from a management level, but also administrative support for using research in everyday practice, and that will support the scale up of various interventions. One way to overcome this sort of barriers is to provide in-house training on research methods and skills and how to critically review evidence, to create a work environment that supports evidence-based practice. And also in-service training on how to actually promote these programs, how to engage clients, and so on, would be a helpful facilitator to make better use of the evidence in practice, and to in longer term support the scale up of various interventions.
Okay, so another question has just come in. Have you managed to separate out a way of identifying what is program and what comes from the personal skills of an inspired staff member? It's a good question, and it comes up a lot. I think I guess a couple of things to say. There's a nice example, particularly around on the functional family therapy program, where the study looked at implementation of functional family therapy, and it looked at the extent to which different practitioners or different therapists stuck with the program and delivered it well, in other words, with fidelity. And what it showed is that on average, when practitioners delivered it with high fidelity, you got better results. And when they delivered it with lower fidelity, you got worse results. However, what it also showed was that within that there was some variation. In other words, you would have some therapists delivering it well with high fidelity, whose young people showed quite high rates of recidivism, and you'd also have some therapists not delivering it particularly well, whose the young people that they were working with showed quite low rates of recidivism. So that's just an example, I guess, to show that both matter. Practitioners do matter. What they bring to it does matter, but ultimately, so does fidelity to the program. And we would argue that ideally, to get the best results, you need both. I think the other thing I'd say about this is that quite a lot of these programs, and functional family therapy is a good example, spend quite a lot of time helping the practitioner to do some of the things that we think of as being kind of innate. In other words, we might think that certain practitioners are more empathetic or more understanding or whatever, but a program like functional family therapy actually spends quite a lot of time helping practitioners to do things that develop a good relationship with the family. So it's a really good question, and it's something that certainly in our field people are asking a lot.
Are you willing to take another question?
Sure.
Can you say more about system readiness?
Yes. So system readiness, I think, it's a bit of a clumsy term, but we think it's an important concept, and the reason we think it's important is because there are lots of programs that are developed typically by scientists working in universities who are primarily developing the program because they're interested in research and they're interested in what it tells us about children and young people's development. And it's great, and they do really good studies, but the problem is that there's then not a mechanism for getting a proven program out more widely. So you come across a lot of programs that maybe have been evaluated once or twice, they show really good results. But if you're sitting in your office and you think, I'd really like to implement that program, there's no way that you can do it. The program may not exist. It may not have any manuals or training materials. There's probably not anyone on the end of the phone who you can call up to order something or to ask them a question. So we think system readiness is really important, and programs like functional family therapy, for example, or Incredible Years pass this test. They have really good quality materials. There's a really clear process for identifying the young people that the program is suitable for. They have systems for monitoring fidelity. If you take Incredible Years, for example, if you deliver those parenting programs, you need to take videos of your sessions. These get monitored by someone to make sure you're doing it properly. There's a whole infrastructure in place, I guess. So that's what we think is important. And I guess the flip side of that is, and I guess this is more about the readiness of the system for the program, but that some programs, systems need to be prepared to accept programs. For example, they need to think about, well, what staff do we need to deliver this program, and what training do we need to put in place? And we'll talk more about this in a future webinar, but it's a really good question. Okay, so another question that's come in: how can we balance the need for systematized support mentioned in skilling up practitioners, such as in-house training, with restricted resources and funding? That's a challenging one. I'll give that to Trin.
Yes, I can't promise I'll have a very elaborate answer to that, but it relates to the funding streams, similarly to the funding streams that are essential for actually implementing evidence-based programs and scaling them up. The everlasting question about where to find sustainable funding to implement all this, and without stopping on it for very long at the moment, I just want you to encourage to join us at our next webinar where we talk about commissioning evidence-based programs. And one of the things we're hoping to cover there is to talk about different ways how to find funding for these sort of activities. And one of the things we will discuss in more details is using reinvestment strategies, which could be one of the things that can be applied to redirecting resources, those limited resources, from certain activities to another. So I'm afraid I won't answer your question in detail right now, but I'm definitely hoping that we'll do it next time at our next webinar in 2 weeks' time.
Great, thanks, Trin. Okay, another one's come in. Do you have a view on the role of consultancy and supervision in effective programme development? We're interested in your views about what constitutes effective supervision in relation to effective programmes and evaluations. A really good question. I think first thing to say, I think, is that there's not a huge amount of research on that. So people tend to think, well, we did this amount of supervision, we had this support structure in place, we got good results, therefore the what we did was effective. But to really know whether it was effective, you would need to deliberately vary the type and amount of support and supervision that you're putting in place, and maybe have one group that has a high level of support, one group that has a medium level, and so on. So those studies are very few and far between. So the truth is, we don't know. However, there is it's certainly true to say that when fidelity is not monitored and when you don't have good supervision and support in place, you tend to get people straying from the program, and they tend to go off a bit more on their own and do what they think is the right thing rather than sticking to the program. All of the programs that we've mentioned today, and if you look on the some of the databases I've cited, they will list their support and supervision arrangements, often in a lot of detail. And our advice would be follow those. If they say we think supervision, intensive supervision, is the best thing to do, then follow
that. We have a question on whether we will cover how to develop a pre and post measure. And we don't have a separate session specifically on that, but we are definitely going to touch upon it on in our final webinar that will focus on what do you essentially have to do to go through the whole pathway from an innovative idea to a product which comes essentially from the randomized controlled trial and shows that it works. So we're definitely going to touch upon that in our final webinar, which again, you're welcome to join.
Okay, another question come in. With regard to maintaining high standards, is there or should there be a requirement for programs, especially national ones, to be reviewed or evaluated formally X years after having been in implementation? That's a good question. I'll kick off on that and maybe Trin will chip in. National programs, I'm not so sure whether this relates specifically to national programs, but I mean, my sense is we should continue to evaluate things. I think one of the problems we have in our field is that programs tend to morph. They start off as one thing, and then they become something else because people add bits to them or take bits away or adapt them for a different group and so on. So what you evaluated in the first instance and found to be effective might end up almost being a different program 10 years down the line. So I think that's certainly something to look at. A second thing, which is, I guess, partly related, is that we should be more interested than we are in longer term impact of programs. A lot of evidence-based programs are only evaluated at the end of the program. They're not evaluated in the longer term. Some are. Blueprints database requires that to get to the highest status on Blueprints, you have to have evidence of impact at least a year after the end of the intervention. And of course, some programs like Family Nurse Partnership have evidence of impact well into adolescence and even early adulthood, even though they were implemented in the early years. But I think the point, the questions are good. I don't know if Trin, you have anything to add on that?
I was just thinking about the Family Nurse Partnership in the UK, which essentially is a national delivery of a already evidence-based program, which is still being trialed in the UK as well. Even though it's shown to be effective in other countries, research predominantly coming from the US, um, it's still being trialed in the UK. And the work on this continues. The trials of an individual FMP, the trial results should come out hopefully this year. And currently, there is a variation of FMP, group FMP, being designed and soon also trialed. So this is a good example how something that is a big, large-scale national delivery and a scale-up of an evidence-based program, that the work on this still continues while the service is being provided.
Okay, another question. You've mentioned some programs quite a lot. Are there other examples of early intervention or treatment interventions relevant to youth justice?
There are actually many interventions, early interventions out there that could be relevant to the youth justice, particularly because a lot of outcomes that either prevention programs or early intervention programs target are linked to later offending. So, doing a lot of work at the earliest stages of child development may end up being much cheaper than intervening later, as offending has been avoided. Family Nurse Partnership that I just mentioned is one of the examples of a good program that has positive outcomes for both moms that participate in that program. It's a home visiting program for young expecting mothers who are expecting their first child and who tend to come from low income backgrounds. And this program reduces offending behavior in those mothers, but most certainly in those little children who are being born over the course of the intervention. Another example of a similar intervention that could affect offending behavior and specifically reduction in it would be parent-child interaction therapy. Very different intervention from FMP that we just mentioned. It works with a pair, a parent and a child, and there's a therapist. And the idea is to really reduce behavior problems, which we all know are linked to future offending. Yet a completely different type of program would be a Big Brother, Big Sister. That is a mentoring program where a young person who has certain elevated risks of certain types of behaviors are paired up with a mentor who meets up with them, provides them support, and so on. And one of the outcomes that it affects is their violent behavior and alcohol and drug abuse problems. So there are a number of programs out there that, in one way, either directly or indirectly, link to the reduction in offending rates in the future.
Okay, I think that's probably all of the questions. So I'm going to hand. So Trins, I think, is just going to do a quick wrap up.
Yep. We have now reached the end of our webinar. And thanks to everyone for joining us today, for your kind attention and for your questions that you sent through. The questions that we did not manage to perhaps respond yet, we'll go through them and we'll send you our answers to frequently asked questions when we send you the link to the recording. This was our second webinar of the series of those 5, and we would be really grateful if you could provide us feedback on today's webinar on evidence-based, what are evidence-based programs, through our online feedback form, which you will be receiving a link to in our follow-up email, like we did last time. As you probably know, each webinar complements and extends the previous one. So therefore, we're really inviting you to join us at our next webinar on how to commission evidence-based programs. And that will take place in 2 weeks' time on the 1st of May. So we hope to meet you again in 2 weeks' time. And if you have any questions or comments, feel free to email. But yeah, that's all from us. Thank you.